My name is Crystal Dilworth. I'm a neuroscientist with a PhD from Caltech in Pasadena, California. Our pets. The bond between us has never been greater. So when a dog or cat falls ill, it can be devastating. Now, new medical breakthroughs can help save the lives of pets like never before. VOA TEK goes inside one of the world's most advanced animal medical centers. We'll see the newest breakthroughs and meet the pets defying all the odds.
Powering the future. Confronting the world's challenges with cutting-edge solutions, medical breakthroughs, and high-tech discoveries. These are the stories of our planet. This is VOA TEK.
When the Fizilic family sends out holiday cards this season, they will look something like this. 3 generations gathered around the centerpiece of the household, their dog, Tyson.
He's not just a dog. He's my son, pretty much. He's my first child. And, he's our family.
Meet Brianna Fizilic, mother to an adorable little girl and one big, goofy boy.
When he was 2 months old, we adopted him from the SPCA. So I remember seeing his little picture when he was like super little. And I was just like, oh my God, I have to have him. And he was the one that really liked us and we really loved him. So ever since then, I've had him.
Tyson just may have been given an extra helping of energy. He runs like there's nothing holding him back. But it's obvious something does.
And how did you first discover his condition?
So we first discovered his condition. It was really a shock to us because we were told that he had arthritis. And the whole time we just were under the assumption that he just had arthritis.
Let's take a listen to his heart and his lungs.
And then last August, he just woke up one morning and could not walk at all. And it was just I felt like I was like, okay, I know something is wrong with my boy, and it's not good.
So cancer in people and cancer in animals can happen for lots of different reasons. What type of cancers do we normally see in dogs?
Yeah, so just the same ones that we see in people. Okay, get up, bud. Come on, Tyson. Okay, we'll just feel his belly, make sure everything feels okay in there.
Michael Kent is Tyson's veterinarian. He's a radiation oncologist. It turns out Tyson didn't have arthritis. He couldn't walk because he had a tumor growing in his left hind leg.
We have all the same organs, we have all the same physiology, we have very similar immune systems, so unfortunately, we develop the same types of tumors too.
So you sent the x-rays and you got the call back right away, and they knew after, without even examining him, that it was likely an osteosarcoma?
Yes, just by looking at it, they decided to bring him in. Sorry.
No, it's okay. No, of course, it's your family member.
So we came, we came in, sorry.
It's all right. Take your time, this is hard. What's a typical prognosis for osteosarcoma?
Unfortunately, osteosarcoma has a pretty poor prognosis right now. Most dogs will succumb to the disease even with surgery and chemotherapy in about 10 to 12 months. That's about half the dogs will die by that time.
Brianna didn't have many options. Doing nothing would mean certain death. Amputating Tyson's cancerous leg could buy some time, but only if the cancer had not spread.
It was one of the hardest kind of decisions we've ever had to make because it was just, my mom is like his grandma, and my daughter, I have a 6-year-old daughter, she's his sister. She doesn't have any other siblings. So he's, they're very, very much attached. So something in me just told me to do it.
The UC Davis School of Veterinary Medicine sits on the sprawling University of California Davis campus near Sacramento, California. Inside, it's a full-blown medical center with a critical care emergency center operating 24/7. This morning, a team of doctors works to save the life of a cat rushed here with serious injuries. Tensions are high, but the team calmly focuses on treating the patient. Just down the hall, the hospital's surgical center works are full capacity. Teams of doctors prepare for surgery, and Joshua Stern oversees this complicated, multifaceted operation.
I mean, the operation is actually quite large. How large is it? How many animals do you see? How many staff are working in?
We're a really massive veterinary teaching hospital, so we have about 50,000 patients a year that we see across all of our specialty services. We're one of the biggest in the world in terms of teaching hospitals. What happens here is specialty care, community practice, clinical research, innovative application of new data in terms of treating pets. There's just so much going on out there.
Waiting very patiently.
Everyone needs a guardian angel, and for Tyson, it was Jackie. She stayed by his side as the family navigated a difficult surgery. There's a bond between the two that survives time and distance.
I will never forget the day that we picked him up from the amputation. It was really, really hard. Jackie was with him the whole time. I will never forget the day that she brought him out.
But Tyson's care didn't stop there. He's also enrolled in a clinical trial, testing a high-tech treatment called IL-15.
So IL-15, or interleukin-15, is basically a molecule that can help activate natural killer cells. Natural killer cells are one of your immune cells that you have in your body that can attack cells that are infected with viruses, but also can attack tumor cells. The reason we're doing that is usually this tumor spreads to the lungs. So while we can take care of the local disease, we have to worry that it's going to spread to the lungs, and that's what usually kills most dogs and people as well who get this.
The treatment with the IL-15, because it specifically targets the lungs, is being inhaled so you can get the signal specifically to the lungs?
Yes, so it's inhaled, it's nebulized, and the owners can do this at home with this little nebulizer, and they breathe it in, and it spreads through the lungs.
And the idea was to prime the natural killer cells in the lungs to try to kill any microscopic disease that might be there that we couldn't see. We didn't see anything there, and this trial is hopefully going to extend his life and decrease the chance that the tumor spreads in his lungs, and that's almost a year ago now.
Tyson got a treat from Jackie for all his hard work. And as always, true to their connection, a big hug. Tyson has beaten the odds so far, and every day is a gift.
So Tyson actually just turned 9 on July 16th. So he actually just had a birthday. And we decided this year that we definitely needed to make extra special for him. So we got him a cake, and I got him a little button-up, collared shirt. And, we sang happy birthday to him, and we even sent pictures to Jackie, his best friend. He definitely is getting up there in age, but he has a lot of drive to still live, and he's been through a lot, and we hope to have him many more years.
And I hope you do too.
Thank you.
So what is the difference between being a medical doctor for animals versus a medical doctor for humans?
Good question. I don't know. My patients are the best.
The medical professionals here are true heroes. Many have their own pets, and they often bring them to work. This is Dr. Kent's dog, Danson, who kept right by his side while we conducted our interview.
So I did my undergraduate education just like anyone else would, and I went to veterinary school, which was 4 years. Then I did a year of internship at the University of Pennsylvania at their veterinary school. Then I came back here and I did 4 years of residency. And then I did my master's in another 2 years in clinical research.
When you shadow a veterinary expert like Dr. Kent, you experience the full emotional journey. His day, jam-packed with patients, each presenting a unique medical challenge. Our next patient, a wonderful senior dog named Luigi. This would be Luigi's 20th and final radiation treatment. If all goes well, this certificate awaits him, a graduation gift from the team here who've come to know and love him.
I think it's important for the pet-owning public to understand that veterinary medicine has come a long way. And so if you had a pet as a kid, what you remember about the veterinary care that could be provided is probably vastly different. There's not very much we can't do these days in terms of specialty care and providing really novel, cutting-edge therapies for pets.
So this is Luigi?
This is Luigi, and Luigi had a tumor on his back over there that was surgically removed, but they weren't able to take it all out. So he finishes a course of radiotherapy today. This is 20th treatment.
This is your last treatment, Luigi.
Yeah.
So this system was designed for humans, but you're using it for dogs?
Yeah, they don't make linear accelerators just for dogs and cats, so or horses, and so we treat dogs, cats, and horses with this. And so it's one of the most advanced machines available for it. It has a built-in CT scanner.
Vet techs, Lindsay and Michelle, got to work prepping Luigi for treatment. For Dr. Kent, the challenge will be delivering the proper dose of radiation, but staying clear of Luigi's spine. This high-tech machine will help, but the patient must be kept still. For that, he's placed on a bed specifically molded to his body.
I have to sculpt the dose around his spinal cord. So in order to do that, I have to have him in the same position each time. We're gonna turn out lights in a minute. You okay with that? So we can get him pretty well lined up with the laser system here, and then I'm just gonna make sure he's straight. I'm just gonna use the green are the different lasers, and so we use those to line up on some of the marks we make. That gets us pretty close. And then, good? Yeah. So now we're just gonna check clearance. Lindsay, you okay if I bring the arms out? Okay. Here, what we're doing is bringing out the arms, and we'll be able to image with the CT scan. So first thing I'm gonna do is check clearance. Lindsay, we're good? So Lindsay's monitoring his anesthesia the whole time. That's her job to make sure we're doing this safely. Most important thing is that he's safe during anesthesia and that he doesn't move, and so she keeps him in a very light plane. And then I just check clearance to make sure we're not going to hit anything. You can see it's pretty tight in order to get this around him.
Then it was time for us to clear the room. Several video cameras will keep an unblinking watch on the patient. Other monitors will keep a check on his blood pressure, heart, and respiration rates. We joined Dr. Kent at the monitoring station.
So it's taking multiple images and then it's going to reconstruct them into like basically almost a 3D image. You see his spine coming in right now. If we're not well positioned, we can make subtle adjustments using the computerized couch. I'm going to just sign off on it, and then we'll go inside and make those shifts. We're going to slide them over. This does a partial rotation. It doesn't have to go all the way around everything, so we're going to move this up.
Then it was time. Luigi's final radiation treatment. We cleared the room once again and watched the treatment from the control room.
What's happening here is this is kind of a bird's eye view of that collimator I showed you. So as the machine's rotating around Luigi, the head you're looking at right here. And so the opening is actually where the radiation's coming out. And you're kind of hearing the beep, beep, beep. That's the sound of just giving us an idea of how quickly the radiation's coming out. I've been doing this over 20 years now, and the technology has just really just moved forward with so much we can do better. We treat a lot more brain tumors now. We're able to really target things that we couldn't even do before.
The treatment was surprisingly quick. Just a few minutes after it started, the machinery slowed to a stop.
So you can see here we are now finished with Luigi's treatment, and so he's now done 20 treatments.
Congratulations, he's graduating.
Yeah, he's graduating. He'll go home this afternoon when his mom comes to get him.
Luigi's certificate is already signed. Congratulations, it reads. I love you so much. From VOA TEK Michelle. Luigi is 13 years old. He should live out his senior years cancer-free.
I think we've taken the best of what's been learned from human medicine and applied it to dogs. I mean, that's the whole concept of one medicine. It's understanding that animals and diseases are very similar or the same as diseases in humans, and being able to take what we learn in one and apply it to the other. And that works both ways.
The innovations at UC Davis are many. You wouldn't know it, but this guy is the perfect example of how far science has come. This is Maverick.
Hi, my name is Heidi Platfoot, and I am Maverick's mom. I adopted him from a rescue in San Diego when he was 3 months old. Maverick's been part of our family for a long, long time. Yep. And I have a 5-year-old son who is his best friend. About a year and a half ago, in January of 2021, we found a small growth on the front of his mouth. We learned that it was a fast-growing tumor in the front of his face, and that if we didn't have it removed, it would grow rapidly.
Boaz Artsy is Maverick's doctor. He is director of the Veterinary Institute for Regenerative Cures at UC Davis. If you catch Dr. Artsy standing still, it won't be for very long. He has a soft touch with all his patients, cats and dogs, but it's in the research facility that Dr. Artsy is truly innovative, doing critical work regenerating tissue and bone.
I'll tell you something about regenerative medicine, tissue engineering. It's magical. It's literally, it's magical.
When he went in for the surgery, they let us know that they would cut off his jaw, maybe at one of his molars or so, and then forward. But they weren't exactly sure how far back it would go. But then when they did the first surgery, because of the size of the tumor, they had to cut back even farther.
The poor pup went home with Heidi and was nursed back to health. The tumor was gone, but his mouth wasn't the same. Essentially, the entire front piece of Maverick's lower jaw was gone. Dr. Artsy showed us what it looked like on a computer-generated 3D scan.
Okay, so this is Maverick's. You can see that the tumor was here, and we're going to do an overlay just to show you all this bone loss. See that?
Oh, wow.
All of this was tumor. All of this is tumor. Tumor here. That's why we had to take
That's why you had to
the
take
front.
that whole
Yeah.
section.
Before surgery, Dr. Artsy makes 3D printed replicas of the patient's bones.
So that is Maverick's before surgery, before amputation, and that was Maverick after.
So how did they fill the gap in Maverick's missing jawbone? Dr. Artsy shows us a vial of bone morphogenic protein. It's kept on ice in his lab and helps the body do something extraordinary: grow bone.
How long does it take to see the regeneration start to happen, and how much more quickly does the healing process occur?
So when we get our patients back from surgeries, and it's a phenomena to see, before you see it, you feel it. So when we palpate the bone at the time when we remove sutures, there is already hard bone feel to it.
Maverick, can I feel your jaw?
Today, Maverick's getting a checkup from Dr. Artsy and senior resident Dr. Shirley Cott.
And what Dr. Cott is doing right now is palpating the lower jaw, especially where we had the surgery. And you're welcome to put gloves and touch it yourself. It's rock solid. It's bone solid, not rock solid.
I really wanted to take Dr. Artsy up on his offer, so I grabbed a pair.
So this is the section of Maverick's jaw that was regenerated. And you can't feel any different. It feels just like bone. And it seems like he's using it great. Huh. Yeah, look at that face. Such a good boy. And a smile.
He loves to play fetch and is obsessed with balls, so when we learned about the tumor, that was kind of just made it a little bit harder because that was his obsession in life, so. And he can still catch a ball, and he even chewed up a tennis ball the other day, which I would have hated, but I loved it. It made me so happy, so it's pretty miraculous, I think. He's living on bot time in my eyes. This is all bot time.
Dr. Barbara Filliquist is a colleague and often collaborator in bone morphogenic protein research. Her focus is orthopedic, while Dr. Artsy handles oral reconstruction. This is her patient, Wagner.
How do you think that he's using the leg?
Oh, much better. Much better, yeah.
Tell me a little bit about Wagner.
Yeah, so Wagner, he is I think he's about 3 years old now, Border Collie, and he is definitely a complex case.
To hear Wagner's story is to love the little guy. Too much energy, not enough bone density is his basic problem. Today, he's back for his post-surgical exam. But Wagner's case file is long and complicated. He was born with some hip trouble and never allowed the corrective surgery to set. The result? Several unsuccessful operations and one twisted leg. Dr. Filliquist knew she could help.
Can you walk me through how you use a model like this to decide what to do in the surgery?
You know, what do we need to do? We know that the hip joint's kind of fixed here, so what we can do then is rotate down at the stifle joint if we make a bone cut and kind of free the femur.
You had to re-break the bone to realign it to heal it again.
Yes, yep. It always seems counterintuitive, right? I'm just pushing, making sure that he is comfortable when I do that. And I can kind of tell at least that it's not overtly painful because he's not pulling his leg away from me.
Wagner is 12 weeks out from surgery and seems to be doing well. He was given BMP to help reinforce the bone and speed up the normal healing process.
But again, just looking here that this leg is kind of in the same orientation, same plane with all the joints, tell us that that there's no sort of abnormal rotation and movement of one joint versus the other.
That's great, Wagner.
I know, we love it, Wagner.
So for an overly enthusiastic patient like Wagner, what do you expect in terms of the healing, given that he's clearly not going to stop jumping around?
Yeah, no, I think at this point with the BMP, you know, I'm very hopeful that he's going to be healed. We did recheck him in the interim, so you know, about 6 weeks ago, we saw him as well already, and we saw he wasn't healed 100%, but he was definitely moving in that direction.
Dr. Filliquist showed us Wagner's scans.
This little sort of white fuzzy material sitting here, as well as in the front, that's the BMP on that material that we put in place. But if we look at this then, which was immediately after surgery, and compare that to yesterday, we can see that he's formed a lot of new bone coming all the way across here,
look at that.
as well as in the back.
I am a cat lover, so our next patient stole my heart.
So this is Julio. Julio enrolled in our clinical trial 5 years ago, received 2 stem cell therapies. He had severe oral inflammatory disease that, he's purring. And I'm gonna open the mouth now and you'll see.
Oh, nice and pink.
Nice and pink, and look how he lets me do it. When you first see it, wow, if you're not aware of the severity of it or how it looks, it's dramatic. Because everything is red.
Yeah, we live on a ranch. Julio showed up one day about 11 years ago. So he was scared of people and scared of anyone around his head.
Brian and his wife thought Julio might have been abused, but it turned out Julio's behavior was due to stomatitis, a painful and difficult to treat oral infection.
In a sense, what's happening, the body sees that there is an infection, mounts a response, the cell got exhausted, and what the body does, we need more. Produce more, and then you have high numbers, and that is still not effective.
In this 2019 UC Davis presentation, Dr. Artsy showed off his innovative treatment for stomatitis via the use of stem cells. On the right side of the screen, you can see the cells captured on a real-time live stream camera. On the left, the delivery of those cells.
With our cell therapy, when we administer it systemically into the veins in high dosage, we are able to reverse this, and we're able to reverse it in about 60–70% of cats. So the stem cells are actually coming from cats' fat tissues. So cats have a lot of fat in the belly, under the skin.
And how are the stem cells treated before they're used?
We process them in the lab. We isolate them we culture them. So it's a process that takes about 10 days.
So it's less of a treatment and more of just an amplification.
It's a purification and amplification.
Some days miracles are hard to find, but not in this case, not today. He's, you know, really, we are enjoying every day we have with him.
We are very excited about this. This is really one of the things that I'm very proud of.
It's pretty astounding when you walk through the hallways to see what's happening. Just yesterday, I was walking from my office here in the teaching hospital over towards my lab, and ahead of me getting on the elevator was a sloth.
Sure.
And so what's not going on in this building, I think, is a really good question.
For us, it was a foal, a beautiful young horse in for a high-tech treatment for her breathing issues. Not a sloth, but not bad. Our final patient is a 1,200-pounder named Isabella.
We're going to start with the foot on the right. So the scan is going to be 4 or 5 minutes for each foot.
Isabella is here to see Dr. Matthew Spreet, head of the UC Davis Equine Diagnostic Imaging Program.
And so from these x-rays, we knew that she had some issues. So the area that's commonly a problem in horses is that little bone here, just in the center of the hoof right there. And this is called the navicular bone. And what we're looking at here is a foot, but it's actually a single digit. If you think about it, it's a 1,200-pound animal and can run at full speed, and that puts a lot of load on that little bone.
Today, Isabella is getting a PET scan, which should reveal more about her injury. The process started a short time earlier in the barn, when techs injected her with a tracing element. Then, they carefully checked for radioactive leaks.
To do a PET scan, we need to inject a small amount of radioactivity, and so it's like a tracer. In this case, that's going to be specific for the bone. That's true. We have to document everything in terms of radiation use, and so we order like a specific dose and we inject that. But then we need to measure and make sure that we indeed injected some radioactivity and that it's not like a crazy amount. So everything is recorded.
This PET scan is a breakthrough innovation. Within 15 minutes, we were looking at Isabella's images.
You can see that hot spot.
We can definitely see it. And so, yeah, that's actually a great thing of PET, is that it doesn't lie and it's pretty clear and pretty straightforward. And so what we know here, we knew from the X-ray we looked at earlier that she had some chronic issues going on there. But the question is that, is it very quiet now? Is it not that much of an issue, or does she have some activity? And what do you think?
I think definitely there's a lot of activity there. I mean, it's almost like it's describing the shape of the bone as you showed me on the radiograph.
Yeah, exactly. And so it just like, that bone like really lights up. And so it's telling us that there's a lot of like bone turnover happening in there. And so that's what's very exciting about that technique. This is a male that, because of this injury, has been retired from her athletic activity. So she's a male who now became a brood mare, so it's a bit of a different story. Honestly, if the goal was to keep this horse active in competition, based on the information we have here, it's very unlikely that this horse will be suitable for some active competition.
So this type of information would be a career-ending scan.
This is a career-ending.
Isabella will get treatment and should live out the rest of her life pain-free. Tyson will hopefully celebrate many more birthdays to come. If Tyson, Julio, our pals Wagner and Maverick could speak, I'd imagine that they would say a big thank you to all the heroic medical workers here at UC Davis. But since they can't, we'll just have to say it for them.